Hello viewers, welcome to SATV's popular health show Doctor's Voice. Today, I, Dr. Tasmeeyh Ahmed Huma, is going to host this whole episode. Today we are going to discuss about a critical and an important topic called cancer awareness and management. Cancer, it's a topic that we think about it that who has cancer, he or she might die. But nowadays, there are different ways to survive on it, and we are going to discuss about that topic. For this discussion, we are privileged to have two renowned doctors from the team of legendary Dr. Suresh Advani, Dr. Shivam Shingla, consultant medical oncologist, and Dr. Kirti Bushan, consultant surgical oncologist. They are practicing in Mumbai. And we are now going to discuss about cancer awareness and management. Okay, so how are you both?
We are doing good, Huma. Bangladesh is treating us really well.
Okay, so this is for the first time or you came here before?
So I'm for the first time coming in Bangladesh, and it's a great honor, pleasure and privilege to be here.
Okay.
And thanks for inviting us and letting us interact with beautiful Bangladeshi people indirectly.
Thank you. So this is for the second time you are here.
This is my second visit. It's the love of Bangladeshi people which attract me.
Okay, what thing you love or like in Bangladesh?
I think the hospitality of people.
Okay.
I always see smiling and warm people.
Okay, thank you. So welcome to our country as well as our show. So the topic, the cancer. It's a topic that everybody afraid of. Such a normal people who don't know about cancer, they always think that if anybody has cancer, he or she might die, and this is the end of the life. So we want to know about it from you, details. So first, I want to ask you that in Bangladesh, which type of cancer patient you got or found?
So Huma, when typically patients who come to me, I find that lung cancer is very high in Bangladesh. And I think smoking is one of the reasons that a lot of men I see smoking here. The second most common cancer is the cancer of the gallbladder and stomach cancer.
Okay.
Somehow these three cancers are very, very high in Bangladesh.
Okay.
So I would like to put one message clear that cancer is preventable, treatable and defeatable.
Okay.
If we certain dietary and lifestyle measures, if we follow, we can prevent it from occurring inside in our body. And if it is detected early, if we catch the signs and symptoms early, detect it early, it's almost curable. Okay. So lot of advances has been made in the field of medical as well as surgical oncology. The treatment has been modified, the treatment is now patient friendly and outcome is very good.
Okay,
so
thank you.
Second thing, as far as Bangladesh is concerned, a lot of patients we get, as you rightly pointed out, that lung cancer patients, because of smoking, because of pollution, lot of other things, because cancer is multifactorial. Then again, breast cancers, uterus, cervical cancers, gallbladder cancers, we see from Bangladesh to India coming for surgeries and other treatments.
Okay, okay. Dr. Shivam, I want to ask you that cancer, what is cancer?
So Huma, cancer is very simple. It's an imbalance inside your body.
Okay.
Something that should grow in a limited quantity goes out of quantity.
Okay.
People ask me why it happens. I think the best answer is you are doing something which is causing imbalance. Either diet, calories have gone up, or some toxic compounds have gone up, like you're smoking, or there is imbalance in your genes. So these are the reasons why there is uncontrolled growth, and this leads to cancer.
Okay. Do you think that the cancer is increasing day by day?
So in America, typically, Huma, 1 out of 3 people are dying of cancer.
Okay.
In India, we are catching up. We are 1 out of 7, and Bangladesh is also very high. It's increasing like anything. If I ask 10 people in a room that if one of their family members or one of their relatives is affected with cancer, all of them will raise their hands. The incidence is so high.
Okay, doctor, I want to know that why cancer is increasing like it. Why we don't go to the doctor in early stage? Why cancer patients always comes to us in a late stage?
So mostly in Indian subcontinent, patients come in third stage.
Okay.
The reasons are multiple. First of all, the patients are not aware about how to catch these early signs and symptoms. Secondly, cancer symptoms are very vague. They can mimic other diseases inside body. For example, patient can have peptic ulcer disease, or they can feel like dyspepsia. They may be taking antacids, but that may be actually a stomach cancer.
Okay.
So vague pain in the abdomen. Another thing is that because of lower middle class, more in our we are not that health conscious. So we ignore those early signs and symptoms. Unless and until symptoms are very severe in the form of pain, increase in lump in the body, or having severe bleeding per rectally, per ureterally, or having severe cough, which warrant you to go to the hospital. Then you catch up diseases later on. So these are the basic things where we need to increase the awareness, where we need to educate the people that how to catch those early signs and symptoms of cancer, so that we can detect it early and treat accordingly.
Thank you. Okay, Dr. Shivam, what steps do you want to take for the cancer patients to detect cancer early?
So I think the first is that we have to give up our fear,
Okay.
and we have to give up our denial.
Okay.
Lot of the times I see that one of the doctors have said that this could be cancer, patients just run away, you know.
Yeah.
So my first step is that I want to increase the awareness, give up your fear, start screening. You know, women should screen for mammography, men should screen for prostate cancer by doing a PSA. You should do colonoscopy, you know, just check your colon, stop smoking. So these are the factors. If you implement this, I think 80% of the burden of cancer will go down.
And the age of screening, you think?
So in women, typically we start screening at the age of 40 years.
Okay.
In men, we start screening at the age of 50 years.
Okay.
So this is the typical age where, you know, you should start having discussions with your physicians that, you know, I want to screen for cancer. What are the tests that can be done?
Okay. Dr. Kirti, do you think every cancer patients need surgical treatment?
It's not like that. So if the disease is very early, and depending upon the type of cancer,
Okay.
you can do surgery. But if disease is a little bit locally advanced, it has spread from one part of body to another, or it may be at local site but size is bigger, or there may be certain features where we give first chemotherapy, that is known as neoadjuvant chemotherapy, to downstage the disease and also to kill cancer cells in circulation. Then you may go for surgery. So depending upon the type of disease, where it has occurred, what is the stage of the disease, for all practical purposes, stage 1 and 2 are the surgical cases. Then 3rd and 4th stage you give chemotherapy, so that to downstage them and make them surgically amenable later on.
Okay,
Yes.
thank you. Dr. Shivam, can I just know about the stages of cancer treatment from you?
So this is one of the favorite questions that patients ask me. I
Yeah.
think it's mostly motivated by Bollywood movies, where
Okay.
you just want to know the stage of the cancer. So the treatment of cancer has changed. It's going to be less dependent on the stage.
Okay.
We typically have 4 stages of cancer. Cancer limited to the organ, stage 1 and 2. Cancer spreading to the nearby structure, stage 3. And cancer spreading different places, stage 4. But people should understand that this staging is now having lesser implications on the treatment. People with stage 4 cancers also do as well as people with stage 1 cancers. You know, you have so much advancement in medicine that most of my lung cancer patients today, I don't even give them chemotherapy. So they just receive either oral tablets or immunotherapy. So
Okay.
this is how the things have changed. This is what people need to know.
Do you think that any type of vaccination of cancer
It's a
got
brilliant
for?
question, Huma. I
Yeah.
think after COVID, everyone is talking about
Yes,
vaccination.
yes.
So for majority, 2 cancers have been prevented by vaccination. One is liver cancer,
Okay.
where we are able to give vaccine against hepatitis B and
Okay.
prevent the liver cancer. And one is cervical cancer. So in women, if you vaccinate them at the age of 12 or 14 years or up to 20 years, you can give this vaccine, cervical cancer vaccine. The chances of cervical cancer practically eliminates. So these are the 2 cancers which are vaccine preventable. For
Okay.
other cancers, vaccine is being developed, but it's in very primitive stage.
Okay, thank you. It's a good knowledge for normal people, you know. Okay, Dr. Kirti, I'd like to ask you that after surgery, how many patient is going back to the previous state before they have cancer?
So surgeries have totally reformed. Previously, there used to be mutilating surgeries.
Okay.
There is a big tumor, you remove. We believe that cancer spreads locally faster, so try to remove more and more areas.
Okay.
But nowadays, it's an era of organ preserving surgeries.
Okay.
We preserve the organs. For example, in females in breast cancer, we tend to preserve the breast and remove the tumor and part of axillary lymph node. Similarly, in the case of rectal cancers, we are preserving the rectum and avoiding unnecessary stomas or permanent or temporary. Similarly, we are doing voice preserving surgeries or voice preserving therapies. So, surgeries have reformed. Gone are the days patient used to stay for 15 to 20 days. Now there are technologies, robotic surgeries coming. Patient get admitted one day, in 3-4 days they get discharged. So surgeries have reformed totally. The need of blood loss is very less. We have fantastic instrumentation. We have advancements in techniques. We have refined everything. There are staplers available and leakage from anastomosis is very less. So it has revolutionized totally. So after surgery, patient feels more better and prepared. So whatever the histopathology comes, depending upon that, patient will need adjuvant treatment in the form of chemotherapy or radiotherapy, depending upon what is the cancer, type of cancer, what is the site.
Okay, yes. Thank you. We will discuss some more, but this is a break time.
Thank you, Huma.
Okay. So viewers, now we will take a short break. After that, we will discuss something more. So stay tuned and stay with us. Welcome back to our program. We are discussing today about cancer awareness and management. We have two renowned doctors from Mumbai, India. Before break, we were discussed so many things about cancer. So now I want to know that people, for the treatment, why they choose always to go to abroad, not their own country. Like in our Bangladesh, people always wants to go, they love to go India for treatment or Singapore or somewhere else, but not Bangladesh. What do you think that in Bangladesh, there were not modern treatment here to treat the people or something else?
Uma, it's the human psychology. I see in Bombay, most of the people, they travel to America, who can afford.
Okay.
So whenever we are faced with the fear, we want to run. And I think this is what happens in Bangladesh. People faced with fear, they travel to Bombay or they travel to any other part of the country. This happens in my country itself.
Okay.
Most of the people, 90% of the people from rest of the India, they come to Bombay for treatment. Now there are two good reasons to come to Bombay for treatment. One is experience. It is the pioneer of oncology. Bangladesh has caught up tremendously well. In fact, when most of patients, they come to me, I tell them, go back to your country, the treatment is perfect. Tata also does the same thing. But human psychology, you get more faith when you travel and you have done your best. I think this is the reason why they travel.
What Indian people do?
So 90% of Indian people out of Bombay, they come to Bombay. They want to diagnose their disease and they want to take the treatment guideline.
Okay.
I think Indian actors, they go to America.
Why?
Most of my patients ask me, sir, is American treatment better?
Actors and politicians from all over, I think, the world, they don't like their own country. They want to travel abroad for treatment. Why?
So I have asked these questions to a lot of actors.
Okay.
The only answer which I've got is they need privacy. So most of the patients, most of the actors and politicians, they travel not for the best treatment, they travel for privacy because treatment is long term. They can't sit outside in the OPD with the treatment changes on their body and someone taking their pictures. They don't travel for better treatment, they travel for privacy.
Okay, so Dr. Kirti, I want to ask that if cancer patient from Bangladesh wants to treat themselves, so where they have to go? In Bangladesh or they have to go abroad? If Bangladesh, why? If abroad, why?
So I must say that Bangladesh is improving a lot in terms of having good doctors in this field and in terms of infrastructure also.
Okay.
Whenever any patient is having cancer, he has to do two important things. One is to diagnose with the biopsy whether patient has cancer or not, and second thing he has to do or she has to do a staging, imaging to see whether a cancer has spread to other parts of body or not.
Okay.
Now they can take an opinion from Bangladeshi doctor, and if they are not satisfied, they can take an opinion from an Indian doctor.
Okay.
If the treatment facilities are available in Bangladesh, it can be done, then it is better to do it here only.
Okay.
Trust their own doctors. Whenever it comes in terms of infrastructure need or in terms of certain complex surgeries or the facilities are not available, patient is not, then they can freely travel to India for those cases which can be taken care of.
Okay, thank you. Dr. Shivam, how can we prevent ourselves from cancer?
So I think cancer prevention starts from day one. Obesity is the most common cause of cancer.
Okay.
World Health Organization has said exercise 2 hours in a week and cut down your calorie intake, you can reduce the cancer incidence by 80%.
Okay.
So this is something which people neglect, and we need to bring back to the society, that you need to exercise more, you need to have more calorie food, less calorie food, and improve your metabolism. Cancer is a problem of metabolism. If you can correct that, cancer will stay away.
Okay, thank you.
So you remember one formula, that is LMNOP.
Okay.
L is less of proteins, less of fats, more of proteins. M is more of fruits, vegetables, and N is no to smoking, alcohol. O is organize yourself, and P is physical activity. I think these are the measures with which you can prevent cancer.
Wonderful, wonderful. I want to know from both of you that you are a team from the pioneer and father of medical oncology, Dr. Suresh Advani. So I want to know that about him, that his works and what are you doing as a team of Dr. Suresh Advani?
So, Dr. Suresh Advani has been
Yes.
the pioneer of cancer treatment in the country.
Okay.
He has had more than 45 years of experience in treating cancer patients. When we have a problem in the house,
Yeah.
we look forward to the most elderly person who knows the answer to that problem.
Yeah.
And we reach out to him and ask for solution. Dr. Advani in India is that figure. Anyone who gets cancer in the country reaches out to him to see whether the treatment is right or wrong, or is there anything better that he can suggest based on experience, not
Okay.
only on the data written on the books, but based on his own experience in treating lakhs of patients that he has seen. And I think that is where he scores much more than the rest of the world. And if you see, he is loved by one and all. And we are very privileged to be a part of such a great person's team.
Okay, I want to know some words from you
so
also.
I have been greatly inspired by him, and whatever I am today as a surgeon, it's because of him, because he has trusted me, he has given me more complex surgeries, and he has taken the best out from me. He's just like a textbook in oncology. The more you read it, the more you will gain, the more you will get inspired. He has patience, temperament, the way he listens to the patients, the way he catches their mood, the way he is keeping himself active with the advances in the oncology, it's very, very commendable. He works 24/7. He is an inspiration not only for we people, but for whole of the Indian and for all of the world. Whosoever is in oncology, I think we have one or another thing to learn from stalwart like Dr. Advani sir.
It's a great privilege actually to work with such a living legend,
Definitely.
And
We are privileged and honored to be
really
in this
very
era.
fortunate to have him
Yeah,
in your team.
definitely.
Okay, Dr. Shivam, what do you think about the cancer treatment that we are doing nowadays? What should be the changes we have to take or we have to see in our
So
treatment
Huma,
pattern?
two major development which has happened in the field of oncology.
Okay.
One is chemotherapy is going away.
Okay,
Less and less patients are receiving chemotherapy.
okay,
Majority of our patients are receiving targeted treatments in form of tablets or immunotherapy. The second development is the cost of treatment going up.
yeah,
So with these latest treatment technologies, the cost of treatment is going exponentially high.
So what should be the treatment for normal people? Everybody don't have such a number of money,
So the best trick for them is to diagnose cancer at early stage,
Okay.
start the right treatment at the right time. and save lot of money. You know, the more and more the disease becomes complex, the more and more you get to the right treatment, the treatment becomes more and more costly. So this is what, you know, I would want to give the message, that reach the right doctor at the right time.
Okay. Dr. Kirti, what do you think about the treatment in Mumbai and the treatment in Bangladesh? What is the basic differences you found? Or
it all depends upon things are coming first in Mumbai and then in Bangladesh. So people are getting much matured early regarding the types of treatment, regarding the advancements. Slowly and slowly Bangladesh is also. We should not take away anything from Bangladeshi doctors. They are very good people. They are doing great job, and I think people must trust upon them. And more and more interactions are needed with the Bangladeshi doctors as well as the doctors from India, so that we can exchange our thoughts, exchange our techniques, exchange our things, and the ultimate result is that patient has to get benefited. So for the benefit of patients, both the countries should work together, both the in the field of medicine, especially the oncology, and more interactions, because ultimately we want self-sufficiency, that patients should not suffer. They should get treatment where they belong to, where they should not be running here and there. So we have to improve ourselves technically, and we have to get along with the advancements in oncology. That's what is required at present time.
Thank you for enlightening us with so much knowledge. We are just at the end point of the program. I just want to know, Dr. Shivam, that if you have any message, or if you want to do anything for the Bangladeshi patients, or you are here for treating the people, I think you both are here for such a great purpose. So what do you think? What are you thinking to do for the people or for Bangladesh?
So Huma, I will just want Bangladeshi people to know that because of the internet, two things have happened. One, accessibility is easier, but also it allows lot of bad people to come into the picture. So lot of Bangladeshi people who come to me, they say that we wanted to come to you, but we could not find the right channel. In the internet, people have made fake profiles for Tata Hospital, for us, you know, and they tell false stories to the patient when they reach to our country. So I just want to tell them that try to reach through a proper channel. We are available for you, and most of the times you may not need to travel. Have faith in your doctors. They are wonderful people. Most of them are my very good friends, and you know, trust your doctors. Try to reach through a proper channel, because once you land into a country where you don't have a proper channel, then life is very difficult for them.
Okay, thank you for being with us. It's a great honor to have such a great doctor in our program. Thank you so much for being here.
Thank you very much for having us. Thank you.
So viewers, I think the program, it was a great program, and we have discussed such great things about the cancer management and awareness, and we will be with some else and some other topics in some next episode. But from today I have to go and I have to leave the program, and I think you all are enjoyed like us. So stay tuned and stay with us, and for the next episode we will be here for you. Okay, goodbye.